Hello friends, today I'll be briefing you about modified electrosurgical knife technique for performing EBUS intranodal cryobiopsy. One of the important complications of intranodal cryobiopsy using an electrosurgical knife is the damage to the scope. To avoid this, what essentially we are doing is we are locking the electrosurgical knife handle prior to the insertion of the electrosurgical knife into the working channel of the EBUS scope with the help of a tape. Sometimes you can even use a locker. As you can see from the picture here, as we lock, it prevents the electrosurgical knife from opening inadvertently. Now, after locking it, we are introducing the electrosurgical knife through the working channel of the EBUS scope, and, and this prevents the accidental damage of the EBUS working channel by the open needle. So with this, now we'll see a patient who presented to us with a subcarinal mediastinal lymphadenopathy. First, we try to localize the lymph node and make sure adequate contact between the EBUS scope and the lymph node station. Now we pass the electrosurgical knife, which is locked inside the working channel of the scope. And after that, we ensure that the needle sheath is pushed out and ensure complete approximation of the needle. And once we know that there is a complete approximation of the needle sheath with the mucosa, now we are releasing the lock from the needle handle, and once it is done, now the needle is passed inside the node and activated so that the breach of the mucosa and the submucosa is done with the first activation. Following this, we push the needle further and then reactivate the needle so that we breach the capsule of the lymph node. And once the capsule of the lymph node is breached, now we pass the 1.1 millimeter cryo probe through the working channel of the scope, and then we freeze it for almost around 3 to 5 seconds. And after that, we are removing the entire assembly end block, and this helps us to do the EBUS intranodal cryobiopsy in quite a safe manner without causing damage to the scope while inserting the electrosurgical needle, and the procedure is quite effective in getting an immediate diagnosis. Thank you.